Friends, thank you for joining us again. My name is Dr. Kondur Abraham. I have with me Dr. Kumar Rajgopalan. We had another session where we talked about depression, and we are going to continue the same topic. And today we'll be talking specifically about medications that are useful for depression. But before we do that, let me ask Dr. Kumar about cancer patients. He did mention this in our last show that a good number of cancer patients go through depression. Dr. Kumar, I'm curious, what could be the treatment strategy that we can have for cancer patients who are experiencing depression?
The basic principle of any treatment modality is treat the underlying cause.
Mm-hmm.
If the underlying cause cannot be treated, we need to treat patients with antidepressants.
Okay. So with cancer patients, let's sort of uh, probe into what could be the underlying causes for a cancer patient who has become depressed.
There are several reasons for a cancer patient to be depressed.
Mm-hmm.
One is a very chronic illness,
Right.
and unless it is caught early, it is likely to lead to depression.
Okay.
The very thought of cancer is a stigma. There's helplessness, there's hopelessness, and it's the kind of a death sentence which is passed on you. And it is very hard to overcome this feeling of hopelessness and helplessness. And that is why we need some additional help in the form of antidepressants.
The stigma that people have about cancer, that has reduced, isn't it? I get this feeling that there are people living longer now and there are better treatments and so forth.
I once again feel that unless the cancer is caught early,
Right.
it is a kind of death sentence.
Okay.
We know that the person is going to die. And the person knows very well that he's going to pass away one day or other, sooner or later. And the very thought of death is what causes the depression.
Okay. So, what can be treatment strategies for a cancer patient who has depression?
We need to improve their energy level. We need to improve their sleeping habits. We need to focus on the energy and concentration. And also, most chemotherapeutic agents have side effects like nausea, vomiting, and we need to support them. And a lot of the help can come from the family.
All right. What can family do?
To improve the sense of well-being,
Okay.
along with medication, will lift them up. The morale can be lifted, can be boosted by additional benefits.
Okay. Can be very challenging, just from what I'm hearing from you.
It is a
Working
challenge.
with a cancer patient who is also very depressed.
That's why we try some of the common medications like tricyclic antidepressants,
Okay.
which however have a lot of side effects themselves.
Right.
But the newer ones are more effective and have less side effects.
I think we'll move on to medications. I'm somewhat familiar with psychotropic medications. Let me ask you this. Um, what are some of the drugs that are out there that medical doctors are using now for depression?
As we have classified them in the previous section,
Yeah.
we have SSRNIs like Effexor. We have tricyclic antidepressants like Elavil, norepinephrine, and we have Serzone, and then we have SSI inhibitors like Paxil, Prozac, and these are some of the common medications which have been used. Lexapro is another new addition.
That's a big list there. How do you decide on what medication would be the best for your patient?
See, most of the medication do cause depression, so we got to be careful in choosing the best medicine for the patient. And it's also by trial and error that we can overcome some of the difficulties we have in treating depression in cancer patients. So the newer ones are more effective, like Effexor, Luvox. imipramine, Elevil, can by and large control a lot of their symptoms. And if there's an anxiety component, we try to treat anxiety as well as depression by medications like Lexapro.
That leads to another question that I have. Usually, people who are experiencing depression have that stigma against medications. They just don't want to be on medications. And I think there are certain fears that are attached to it. One is it something that I have to take lifelong? Is it something addictive, in other words?
It is very common in our practice that people refuse to take medication.
Yes.
One, because of the prolonged period, they have to take it for their lifetime, in most cases. And secondly, the side effects also prevent them from taking medication on a long-term basis.
Okay, I like to really address both. One is, what would you tell somebody who doesn't want to take medication?
They need a little reinforcement. They need a little moral support. And by and large, the physicians have to explain why they are taking it, what they are taking it for, how long they need to take that, and the possible side effects. And once the patient accepts these side effects and the possible side effects, they are more accustomed to taking it for a prolonged period of time.
Going back to one of the questions that I raised, are these medications addictive? Do they have to be depending on it for the rest of their lives?
When you say dependent, it improves the sense of well-being.
Okay.
And in most cases, they have to take that for a prolonged period of time.
All right.
And as I said, we need to treat the underlying cause.
Mm-hmm.
If the underlying cause cannot be treated, the patient becomes more depressed.
Correct. Now, how will you bring them out of medications? At what point would you decide on that?
As I said, prevention is better than cure, and that applies here in most instances. We may not be able to take them off these antidepressants for a prolonged period of time. As well as they're on chemotherapeutic agents and they're doing well, we may be able to cut back on the amount of medications they need.
Yeah, that's exactly what I was thinking of. So you would reduce the dosage.
Exactly.
And then bring it to a level that would be, almost zero, right? And
the dosage has to be tailored to the needs of the patient.
Mm-hmm. Okay. All right. So that is saying that they don't have to be on medications for the rest of their lives. Maybe in some situations, yes. But in a lot of situations, if they are receiving counseling and if they are also following some of the other regimens that you mentioned, then they can come off medications, correct? So they don't really have to be dependent on this for the rest of their lives.
I would quite agree with you on that point. But by and large, most of them need support for the rest of their life. Treatment.
Yes. In our last session, you mentioned that depression is a thought disorder. I almost thought at that point, well, not really. It's not schizophrenia. But you do really have a point there. The point is, it's really our thoughts that lead to depression. Negative thoughts, irrational thoughts.
Exactly.
So in that sense, it is a thought disorder. And so the point is really correcting those thoughts. I think that should be step number one, whether a patient should be on medication or not. Isn't it? We talked about, you also mentioned that it is a mood disorder. And so we need to change the moods. One thing that I have observed is that close monitoring of our own moods can be very helpful in really coming out of any of these emotional conditions. What do you think about that?
Yeah, once again, it depends on whether it's exogenous depression or endogenous depression. Right. Endogenous depression, you need combined treatment. Exogenous, you could probably get away just with medications alone.
Now, for the audience, those two different types, exogenous and endogenous, could you please describe what those two mean?
In other words, endogenous depression is more genetic, genetically influenced factors.
Okay.
Exogenous is what we cause in our mind to be the cause of depression.
Those are from external
Factors
factors. So endogenous is basically something from within that.
within us.
Okay. And well, I mean, psychotherapy is good for both. Correct?
Yes, indeed.
And medications too will help both. Well, we touched on something very important. I know there's definitely stigma against medications for depression, and not only depression, for any of these psychosomatic problems. And so we are encouraging people to take medications if that is needed. Correct?
Yes. Compliance is a very big issue in the treatment of psychotherapy.
Compliance, yes. Yes.
So I think the psychotherapist or the psychiatrist plays a major role in coaxing the patient to take their medications regularly.
Yes, yes, yes. I would like to ask you another question that has to do with measuring how depressed a person is. What are some tests that you use to see if there is definitely depression in the system?
Yeah, see, some metabolic disorders like hypothyroidism, hyperadrenalism are some of the causes of depression,
Okay.
are treatable causes of depression. So if we can identify that subset, it would go a long way in treating depression.
That's good. So what exactly is that test again? Could you?
Like you can check for hypothyroidism,
Right.
adrenal insufficiency,
Yes.
diabetes.
Yes.
These are some of the treatable disorders of depression.
So there are tests that you can use to see if there is truly depression, correct? Or the levels of depression.
I think the therapist will play a major role in that issue.
No, I'm talking about like blood tests.
Yeah, they need a general physical examination just to rule out metabolic causes of depression,
Yes, exactly.
like
That's what
blood
I mean.
tests.
Blood test, yeah. I mean, I worked with this patient, I remember. She was depressed, very depressed. I worked with her for some time, and she was not improving. She was not making much progress. And what really was, what the real problem was that she had some thyroid dysfunction. And so when that was found, and when she was treated for that, she was fine. so that's the point I'm making. I think in some situations we can go wrong by diagnosing somebody who may have otherwise a medical condition that is causing depression. So the right kind of tests, blood tests, would be very useful in detecting those. And I think one other thing is, I think this will apply to all counselors. I think before we treat any patient, they should be first examined by a medical doctor.
That's very true. A good physical examination and a workup is essential.
Right. So we talked about counseling, the need for counseling, but before you see a counselor, or while you're seeing a counselor, make sure that you see a medical doctor and have a full examination to see what's going on. And that's so important. Dr. Kumar, thank you so much.
You're welcome.
Jimmy is extremely depressed. He has contemplated suicide at least 3 times in the past year. He looks sad. He hardly smiles, even when there is a good reason for it. It seems like he hasn't shaved for several weeks now. Lately, he has been withdrawing from social activities. He just wants to be left alone. Jimmy doesn't have any close friends. His best friends with whom he grew up have moved away. Jimmy has a master's degree, but he is unemployed. He is married and has 2 young children. He feels very inadequate because he is unable to provide for their needs. Jimmy lives in a rental home because creditors have taken away the home he owned. His job prospects are very low. He feels he is dependent on other people. Jimmy feels helpless and hopeless about his situation. He doesn't know where to turn. I'm sure you have seen people like Jimmy. In the past, both in counseling sessions as well as in response to radio programs, many have shared with me that they felt that their problems were so overwhelming that they have become very depressed. Depression is primarily an experience of thoughts as well as feelings. According to the Diagnostic and Statistical Manual, it is an emotional state marked by great sadness and apprehension, feelings of worthlessness and guilt, withdrawal from others, loss of sleep, appetite, etc. In severe cases, a depressed person would complain of the following: sadness during most of the day, loss of interest and pleasure in daily activities, difficulty in sleeping, weakness, fatigue, and loss of energy, poor appetite and weight loss, or increased appetite and weight gain, negative self-concept, self-blame, feelings of worthlessness and guilt, difficulty in concentrating, slow thinking, and indecisiveness, recurrent thoughts of death or suicide, sense of helplessness and hopelessness. All of us experience some amount of depression from time to time. But people who experience depression as a form of illness may experience most of the symptoms that I presented above. Before we discuss ways to overcome depression, we need to see how depression is developed in our thought processes as well as in our emotional life. Depressed people have a negative view of life. They don't ever see the bright side of life. Due to relentless tragedies that they have experienced in life, such as death, loss, separation, rejection, and so forth, they have mentally given up on life. According to Dr. Aaron Beck, an expert in the field, the depressed have negative views of self, the world around them, and their own future. This is known as the negative triad of depression. They may have developed this tendency during childhood or adolescence. Some of the depressed people also make wrong inferences and connections. They worry about things that don't make sense. Some of them would overgeneralize or blow things totally out of proportion. To sum up, depressed people interpret their own world in such a negative way that their feelings are very pessimistic in nature. Their words carry messages such as, "I am stupid," "I can never do anything right," "I will not make it," and so forth. Depression can also result from anger that is turned toward inside, or even be due to biological reasons. What are some solutions? The first thing that the depressed should do is become more positive in their thinking. They need to change their negative thinking into more positive line of thinking. They need to get involved in some action. It is important to do something and not be idle. People who are unemployed should find something that they can do that will bring them some sense of accomplishment and happiness. It doesn't matter what the action is, but staying engaged in some activity is the key. Socialization is an important aspect in dealing with depression. Lack of social support has been identified as one reason for depression. So networking with family and friends is very important in dealing with depression. Take the initiative to make friends, visit people, or invite people over. Correct negative self-evaluations. Some of these depressed people look down on themselves too much. They may make statements like, "My family can do better without me," or "It won't matter if I'm not here." Depressed people usually do not have a purpose for living. They need to be guided to find meaning and purpose for their existence. Depressed people should be made aware of their rights to live, work, and do everything that a law-abiding citizen is privileged to do. Some of them may have given up on their rights and duties to serve and be served. Finally, we need to see depression as a spiritual problem and attack it from that angle. King David in Psalms 42 and verse 11 said, "Why art thou cast down, O my soul? And why art thou disquieted within me? Hope thou in God, for I shall yet praise him, who is the help of my countenance and my God." Feeling cast down is both mental and spiritual. We need to reawaken our souls by being in the company of people who can lift us up. Indulging in other behaviors such as drugs or gambling will also have severe consequences. Another thing to watch is displacing depression on others by blaming or being verbally and physically abusive. Ironically, it has been said that depressed people are the most realistic people in the world. They are truly in touch with the pains and disappointments of this world, while too many of us have become very insensitive. Just as attachment to material things can be depressive, detachment from material things can be a curative for depression. We are unlikely to find depressed people among ascetics. They have detached themselves from the world and have found asceticism as a way of life. On the other hand, people who are closely attached to the material things of this world are likely to experience more depression than others who are loosely detached to this world. Of course, not all of us can decide to become monks, but we can develop a strong sense of detachment from the world and be more focused on spiritual and philosophical aspects of our life. Friends, I hope you will take a few moments to write to me and let me know what you thought about this program. And would you also please consider sponsoring these programs? All contributions made within the United States are tax deductible. Please make your checks payable to LifeChangers. I thank you for tuning in, and I hope you will tune in again next time. This is Dr. Abraham saying goodbye for now.